So one of the problems that many of my clients bring to the therapy room is OCD. OCD can plague your life. It can absolutely take over your life. It can make you feel that you're living in fear and cause anxiety. So what is OCD? So according to the DSM, it's obsessional compulsive disorder. So you engage in compulsions to make yourself feel a little bit better about yourself. But if we break it down a little bit further, if you think about an obsession being a thought, that's where we need to start from. And if you think about the compulsion is what you do to make that thought okay, then that makes it a bit more palatable. So obsessional compulsive disorder is having a thought, which could be, my mum's going to die if I do not engage with the compulsion, which is turning the light switch off 20 times. Or the thought could be that I need to wash my hands 20 times before, because I don't want to get an infection. So that's the compulsion. So you have a thought and it's associated with the compulsion. But the problem is with a lot of people, a lot of my clients, is that we attach too much meaning from it. So Paul Sarkowski, who actually invented the formulation for this, so a formulation is how we come up with the problem, how the problem is maintained, also said that because we attach meaning to the thought, it becomes very, very difficult to eradicate the thought. So we tend to unpick the thought, challenge the thought, and try and really, really find evidence of the thought. So I use CBT in my private practice to help understand how to manage obsessive compulsive disorder, because it's a way of finding that evidence. You work very closely with the therapist, or you work very closely with a health professional to help you understand and navigate yourself around this, because it can be such an enduring and unhelpful mental health presentation. The other part of OCD, the shortened version of obsessional compulsion disorder, is that sometimes it's linked to early life experiences, and sometimes those early life experiences of distress and trauma can lead to OCD. So OCD can sometimes make clients feel safe, reassured. If they feel that they engage in a compulsive act, that act will make them feel emotionally safe and bring their anxiety levels down, which they may well habituate to and becomes routine. And that's how the OCD generally generates. So OCD can be worked on, it can be successful, and you can use a variety of different approaches. So you can work with this mental health presentation. CBT is one of the areas that I use. If clients feel very stuck and CBT does not work for them, then I try and use other therapies such as schema therapy, especially when there's lots of unmet need or childhood distress that may well have made them feel dysregulated and emerged into OCD. So how do you know that you've got OCD? Well, you'd know because you have to engage in your compulsions when you have your thought. You have to seek reassurance by engaging your compulsions, and that's why you know you have OCD. If it's debilitating, if it's stopping you from engaging in everyday tasks, if it's making you anxious, that's when you know you have OCD. So really be mindful that you have to seek advice and support from a mental health professional, a clinical psychologist, a psychotherapist who specialises in working with CBT. Make sure you find somebody who's licensed or associated with a public body who is able to help and support you.